Hey, welcome back to East Texas Live on KETK. Joining us now is Dr. Patrick Kupperman from Azalea Orthopedics. And today we're talking about common causes of shoulder injuries. So this is your special, doctor. What are the common shoulder injuries that you see at Azalea Orthopedics?
We see a ton. In kids, we see more like fractures, dislocations, and sprains. They don't tear their rotator cuffs as much as older people do. And then as we get a little bit older, we see a lot of rotator cuff tears, as well as strains and fractures as well for the older people as well.
Well, when I talk to the foot guy and the knee guy at Azalea Orthopedics, they say a lot of the injuries just come from normal wear and tear, just from being old and wearing it out. Is that the same thing for your shoulder?
It is. It is. The rotator cuff especially, it's kind of like a heart where it loses blood supply as we get a little bit older, and so it's more likely to have a heart attack or a tear of the rotator cuff whenever there's not good blood supply to it.
Is that what happens to those old pitchers? They just get up in their 40s and they can't circulate it anymore?
Yeah. I mean, a lot of it's mechanics too, especially with the pitchers. But pitchers rarely tear their rotator cuff. They'll tear labrums or have instability and things like that. They'll pinch the rotator cuff, but they don't usually tear it.
So when people come into Azalea Orthopedics, certainly they're not coming from the major leagues. What are most of the injuries caused by?
We have a lot of baseball players in East Texas too, so
it's sports, right?
Yeah, so
okay.
A lot of it's sports. So we have, baseball, tennis, all the overhead athletes, volleyball, they all have it. We see it in football players. We see it in older athletes too. But we can see it also in workers who lift things that are too heavy, or we can just see it again with wear and tear as well.
Sometimes I do this thing where I sleep on my shoulder, and then when I wake up it hurts for a day, but after 2 days or so it goes away. How long does pain persist where you would say I need to make a phone call and get some help?
Yeah, I'd probably look into seeing a primary care physician or so if it's more than a few days or more than a week. But as far as usually is that you can rehab most of your issues to where you don't have to have surgery.
So what are the symptoms that show up where you say definitely you need to come see me or someone at Azalea and get that work done?
Yeah, well, if you can't lift your arm up, you need to see somebody for sure. The other thing, night pain's a big deal. So if it wakes you at night, that's a big deal, especially if it's on the outside part of your shoulder. That indicates some type of rotator cuff pathology usually.
So if I am scared about getting help for my shoulder because I'm scared of surgery and I insist on non-surgical methods, how much can you do for people who are trying to avoid going under the knife?
Probably 90% of my patients don't have surgery. So in a day is that I rehab almost everybody, and a lot of it's the mechanics, and if you correct the mechanics, then usually the pain goes away too.
Oh, that's amazing. So if someone is scared of surgery, you can pretty much say, hey, then you're probably not going to need that. All right, what advice can you offer viewers on how to prevent shoulder injuries?
One is you have to have the proper mechanics, and so it's nice if you stretch before you do stuff, whether it be throwing baseballs, playing tennis, or just working out. And working out's another thing. So by increasing the forces on your rotator cuff, that kind of helps to keep the blood supply as good as long as possible.
All right, Dr. Patrick Kupperman from Azalea Orthopedics. If you have problems with your shoulder or anything orthopedic, you can learn more going to azaleaortho.com.